I think we'll go ahead and get started.
Okay.
My name is Michelle Lane. I am the Senior Director for Community Health and Wellness here at North Kansas City Hospital, Meritas Health, and I am so pleased to welcome Miss Melissa Laycock today. She is a dedicated family nurse practitioner with over 6 years of experience specializing in liver disease and transplant care. Her expertise in the field has made her a trusted resource for her patients that are navigating complex liver conditions. But today, what Melissa is going to share is essential tips on how to love your liver and focusing on risk factors, healthy lifestyle choices, and practical steps that you can take to help your liver stay strong and healthy. So please join me in welcoming Miss Melissa Laycock for her presentation, Love Your Liver, Essential Tips for Liver Health. Take it away.
Thanks so much, Michelle. Okay, so like she said, I'm Melissa Laycock. I do have a history of working in liver transplant and liver disease, and I was the GI educator for a couple of years here at North Kansas City Hospital as well. Okay, we're going to get started. I have a lot of slides. We're going to go kind of quick. I'm trying to make it as visual as possible and not a lot of words, and so that you can actually get actionable steps for taking care of your liver. And let's see. I did want to give a shout out to our gastroenterology group here at North Kansas City Hospital. So if you do believe you have any liver issues and you wanted to get those evaluated, they're an amazing resource here at the hospital to help you do that. I also want to put my resources here. These are the primary ones I use. The AASLD is the primary liver disease resource for the United States, and there's one for Europe as well. But all of this is coming straight from guidelines and is evidence-based. Many of you have probably seen that October is Breast Cancer Awareness Month, and that is extremely important, but it's also Liver Awareness Month, and that's why we decided to do that in October. If we look at the statistics of the leading causes of death in the United States, many people would probably know that heart disease is the #1 killer of Americans. But liver disease is in the top 10 and cirrhosis. And if you look at, let's see, the actual prevalence of heart disease and liver disease, there's only about 1 million less people with liver disease than heart disease. So it's extremely prevalent. It doesn't cause as many deaths as heart disease, but it's very widespread. So this is just not even an inclusive list of all the different types of liver disease, but the ones we're going to focus on are primarily these right here because they're the ones that you have the most likelihood to influence in your life. And primarily alcohol-related liver disease and metabolic liver disease, as those are the two largest types of liver disease in the United States and affect at least a third of the population to some extent. The other thing, at the end of each section, I'm going to give you a little summary of what you can do for that specific issue, liver disease type. So let's start with liver facts and figures. And you'll also notice that I color coded each section to hopefully make it a little bit more easy to follow. All right, so the liver is in the top right-hand quadrant of your abdomen for most people. Occasionally, some people have their organs flipped, but for the vast majority, that's where it's located. It's the largest organ at 3 to 4 pounds. It produces bile, which is that sort of green fluid that goes from your liver into your intestines and breaks down fat. It produces cholesterol for your body. It stores sugar that you eat so that while you sleep at night and when you're not eating, your brain actually it turns back into glucose so that you can maintain your blood sugar and keep functioning when you don't have food. It produces clotting factors for your body. It detoxifies. And that's just one, it's hundreds of functions that the liver actually does. This is a very good video that is on YouTube if you wanted to watch it to go into a little more depth, and it's animated on how the liver actually functions. It's really good. Another point I wanted to make is that the liver is extremely complex. We have machines that can, at least for a time, function as your heart, your lungs, and your kidneys, but we have nothing to replace your liver. If it fails, a liver transplant is the only option. Another amazing fact that many people might not be aware of is that if you resect or cut half of the liver, they usually do the left lobe, right lobe, within about 6 weeks or so, it will grow back to full size if it's healthy. which I think is kind of amazing. Another thing is that the liver is extremely resilient. Even if you do develop cirrhosis, it usually takes many years of damage to the liver. So, and that's actually a good thing, because that means that if you have any underlying liver issues, there's time to intervene and really change the course of the issue. Another point I wanted to make was that it's very common to actually have multiple issues with the liver. If someone, we'll talk about this in the, going down the line a little bit, but if you have metabolic related liver disease and you drink a lot of alcohol, you could potentially develop cirrhosis more quickly. Or let's say that you had hepatitis B and you also drink a lot of alcohol or something like that, or hepatitis B and hepatitis C, which is, some people have had that. Okay, and so I'm going to use the word cirrhosis a few times, and I already have, so I wanted to explain exactly what that is. It is not an actual type of liver disease. It's the result of liver disease. It's the changes in the tissue that happen as something is damaging the liver over a long period of time. So usually it happens in stages. The first stage is fat deposition, then you end up getting some scarring, and eventually you have enough scarring that we call that cirrhosis. And that's the point where the liver function can actually be significantly affected with chronic liver disease. Let's see. So a healthy liver is spongy and blood can flow through it easily. But if you take one of these disease processes and it goes on for a very long period of time, it can cause a scarred liver and you end up with cirrhosis. So the word cirrhosis just means something's been harming the liver and now it's filled with scar tissue, and that scar tissue can affect its function. Another important point is many people, if you've heard of cirrhosis, you might have heard it referred to as stage 4. And that is something we probably should change, because cancer staging uses the word, or cancer language uses the word stages. People with cirrhosis can actually have regression of cirrhosis. So for instance, if you have hepatitis C and you get it treated, it's possible to have some improvement in your liver function. And people can live for many, many years with cirrhosis, in particular, if you can stop whatever disease process was causing damage to the liver. So don't be afraid if you are told you have some scarring in your liver. There's many things you can do about it, and it doesn't necessarily mean it's like a terminal diagnosis of any kind, like it could be with cancer. Let's say, okay. So basically, in my opinion, the liver is a remarkable organ. So let's go on to review the viral types of liver disease, which we usually call them hepatitis. And hepatitis just means inflammation of the liver. So let's see, we're going to start with hepatitis A, and I made that red for A for apple. You can just, for an easy way to remember, is acute, and the body part, that is where it's transmitted. So acute and anus. Hepatitis A is acute, and what that means is if you get exposed to hepatitis A, you can become ill from it. You might experience some symptoms of liver disease, which we'll review: yellowing of the skin, yellowing of the eyes, that kind of thing. But most people recover from it, and after you develop hepatitis A, you would be immune to it. There is no chronic hepatitis A. No one gets cirrhosis from hepatitis A. It's spread from fecal oral, so basically contaminated water, or if you haven't washed your hands. In the United States, we have a very low risk of hepatitis A. It's not 0, but we have a very low risk. And a very small number of people actually die from hepatitis A. Many times those people are very sick from other issues. We have a vaccine for hepatitis A that we give children. It was added to the child immunization schedule in 1996. And we can also give it to adults who are traveling overseas. You can see that since we started vaccinating for hepatitis A, the rates are extremely low at this time. So what can you do for hepatitis A? Make sure that you have the vaccination, especially if you have any other health issues that make you at more risk of having a serious consequence if you developed hepatitis A. Drink bottled water if you go to a high-risk area. Make sure you have the vaccine if you're going to travel to an area, and wash your hands before you eat. overall, your chances of getting hepatitis A in the US are pretty darn low, but there are outbreaks on occasion. So hepatitis B, you can remember this like blood, baby, and foreign born. It's a completely different type of virus. Hepatitis B can cause cirrhosis, and one of the biggest issues with hepatitis B is it's oncogenic, meaning it basically causes cancer, and it can even cause cancer in the liver if you don't have cirrhosis, which most types of liver disease it's unlikely that you would develop liver cancer unless you had a cirrhotic liver. So let's see. I would recommend with hepatitis B, if you do have hepatitis B, I would recommend having a GI physician that's very familiar with hepatitis B or an actual hepatologist, because it's kind of a tricky virus. In the United States, our risk of hepatitis B, our rates are very low. The most common areas are Asia and Africa, where it's endemic. So if you were born in one of those countries, or you're born to someone who was born in one of those countries, it would be prudent to get tested. It's transmitted through blood and bodily fluids, and then mother to baby is one of the main routes of transmission. And it's important we test women when they become pregnant for hepatitis B, because we have protocols that we can do to prevent the transmission from the baby to the mother. It's very, very effective. So just because a mother has hepatitis B does not mean she cannot have a child that would be hepatitis B free. We have a vaccine that became available in the early 80s, and then in 1991 was put in the immunization schedule for children. We generally give the first dose at birth. It's a 3-dose series. And as you can see, just like with hepatitis A, once we started vaccinating, the rates have dropped substantially. There are cases every year in the United States of hepatitis B. It can be transmitted by IV drug use, anything that's blood or bodily fluids. And because of the continued incidence of hepatitis B, and because of the fact that many people are unaware that they have it, the CDC has recommended that all adults be tested once for hepatitis B. So if you have not been tested for it and you think that you have even if you don't have a risk factor, you can be tested if you're concerned. And it's something that if your liver enzymes were elevated, you might want to get tested. The test for that is the hepatitis B surface antigen. Your provider probably will know that, but that's just so you know which test to do. And adults can also be vaccinated for hepatitis B, so that your risk is low. We cannot cure hepatitis B at this time, but there are medications that you can take. It's basically a pill that you take daily, and it's excellent therapy. And that's why it's so important if someone does have hepatitis B to make sure that they get treated, because this will decrease your chance of cancer, decrease your risk of cirrhosis, and decrease your risk of transmitting the hepatitis B to anybody else. So get vaccinated, get tested, especially if you were born outside the United States or to someone who was, and then make sure you use protection from blood and bodily fluids. And the hepatitis B surface antigen is the test that you need. Okay, so now we're going to go to hepatitis C, and you can remember hepatitis C as curable, which is actually a relatively recent. Let's see. Because we do have medication now that can completely clear and cure hepatitis C, rates of it are dropping, whereas metabolic related and alcohol related liver disease rates are actually rising. So hepatitis C, just like hepatitis B, is a chronic liver disease if you do not actually get it treated, and it can lead to cirrhosis over time if it's not treated. At this time and in the past, the #1 risk factor is IV drug use or cocaine use, but primarily drug use. So if you know someone, or if you do use IV drugs, or you had in the past, that is a risk factor for hepatitis C. When the medications that treat hepatitis C, the really effective ones, came out in 2012, the CDC recommended that everyone born between 1945 and 1965 was supposed to be screened. And that's because that age group had the higher risk. But now, and because we've seen rates increase substantially with IV drug use that, according to the information, is related to fentanyl and that kind of thing. They're now recommending all adults 18 and older be tested at least once for hepatitis C. So if you have not been tested, it's the hepatitis C virus antibody that you would want done. And just for your own knowledge, if for some reason that antibody came back positive, you don't be afraid necessarily that you have hepatitis C, because you actually have to have the viral level in your blood. That's because if you were ever exposed to hepatitis C, it's possible that you actually cleared the virus yourself. Your immune system actually took care of it, but you would still have the antibodies in your body or in your bloodstream. So you want to make sure that you actually have the viral level done. And almost, as far as I know, all tests, if you get a hepatitis C positive antibody, will automatically give you the viral level, and that's how you know if you have it or not. There's medications, several medications. This is just a couple of them. Very similar to hepatitis B, there are medications that you take, but the only difference is you only have to take them for 8 to 12 weeks instead of for the rest of your life, like hepatitis B. And they actually cure it. And there is no vaccine for hepatitis C. Unlike hepatitis A and B, we do not have a vaccine for hepatitis C because the virus is so varied, and so we're unable to make one at this juncture. So what can you do about hepatitis C? Make sure you're tested at least once. It's in the guidelines. It should be covered by your insurance. Do not use IV drugs. If you do, make sure that you use clean needles and then get treated if you have a positive test. And I don't think I put this in here, but it's also interesting to know that because we do not have a vaccine and because there are multiple different kind of varieties of hepatitis C, someone who has hepatitis C and gets treated can actually get reinfected with it. So you don't develop immunity to it. So that's one thing to keep in mind. All right, now we're going to go to drug and medication related liver injury. And drug and medication related liver injury, I put this in here. It's not chronic liver disease. It's not something that's going to cause cirrhosis, but sometimes you can have an actual short-term liver damage from a medication or a supplement. And this is something I thought would be helpful to review. Let's see. So, like I mentioned before, if someone develops an acute liver injury, meaning that let's say you took some medication that your liver was causing harm to your liver, you may develop signs of liver injury, and that is nausea, vomiting, abdominal pain, and then you might get some yellowing of your skin or your eyes, and that's related to bilirubin. So that's just so you know that if you ever have those symptoms, think that maybe something has hurt my liver and make sure you get it checked out. One of the reasons why this is an important topic and why we do have drug injury from medications is in part because many Americans take a lot of different medications, and those medications can interact. So our livers are basically one of the first areas of our body. Once you eat, medication goes to your intestines, and there's a blood vessel called the portal vein that takes blood from your intestines directly to your liver first. So your liver is sort of like the gatekeeper for the rest of your body on what gets through. And then also keep in mind that if you have cirrhosis or if you have scarring of your liver, like fibrosis is before cirrhosis, that can change how your liver actually metabolizes medication. So you could be at a higher risk of a medication or drug-induced injury. I wanted to review Tylenol because it's the #1 cause of drug injury in the United States. So one of the reasons occasionally people will take an excessive dose of Tylenol on purpose, but many times people will not realize how much acetaminophen they're actually ingesting because it's in so many products. This is just an example of different medications that have acetaminophen in them. And then a lot of pain medications also contain Tylenol or acetaminophen. And so it's easy sometimes to not really pay attention to how much you're taking. So that's one thing that's important. This is a video that's made by the American Gastroenterological Association. And it's all about reading drug labels, and it's about 5 minutes long or so, but it's extremely good about how to know whether your medications are safe and things like that. So you may Many resources will say that you can take up to 4 grams of acetaminophen per day, which is 4,000 milligrams. But if you wanted to be very prudent, you would probably stay under 3 grams per day. That's because some people still can get some liver injury from up to 4 grams a day if they have other issues going on with their liver or other medications that interact. But I wanted to point out, though, that just because acetaminophen can cause injury to the liver in high doses, it's extremely safe in appropriate doses. So it's actually recommended even in patients that have cirrhosis of their liver as one of the best pain medications because it's effective and it's safe. If you do have cirrhosis, the recommendation is to stay at 2 grams a day or less. So if you have a healthy liver, you can take ideally 3 and potentially 4 a day grams. If you have a cirrhotic liver, recommendation is to stay at 2 grams. So drug-induced liver injury has been increasing with the increased rates of people taking herbals and supplements. And you can see at the orange level at the top are drug-induced liver injuries that occurred from supplements and herbals. And when I used to work in liver disease, we actually did see several drug-induced liver injury cases from random supplements and things like that. The number one category, single category, is supplements that are targeted towards weightlifting and bodybuilding. So just keep that in mind if that's something that you do. There's it's the National Institute of Diabetes and Digestive and Kidney Disease has made this really great resource called LiverTox. And you can just type in LiverTox into Google and you can look up any supplement or herbal that you're considering taking. And so, for instance, just to show you what it would look like, it gives you a category of how likely it is to cause injury. And you wouldn't think necessarily turmeric would cause issues, but there's been several issues of supplements of turmeric causing acute liver injury or drug-induced liver injury. The other thing I like about it is many times it will give you a case study of what the person was doing when they took the medication and what happened. In this case, and in most cases like this, the liver, you get some symptoms of liver injury, but once you stop taking the offending medication, it will resolve, and this person also did fine. And this is just a picture to show you, if you type in turmeric in Amazon, how many different options there are. And this is just you can imagine there's just dozens and dozens of them. And how important it is to make sure that if you do take herbals and supplements, just get them from a very reputable manufacturer, because this industry isn't regulated as tightly as the prescription medication industry is. And there's all kinds of other things added to supplements that you may not be aware of, and those can potentially harm the liver. So just be careful. And this is the National Center for Complementary and Integrative Health. And this is also a really great website. So if you wanted, and they have a whole section on herbals at a glance. I put a arrow there for that. So I think the other one focuses more on supplements. This is more on what would be considered herbals. So just look up your herbals, and also always run it by your healthcare provider too. And I wanted to just mention statins medications, because some of you may be on medications for cholesterol called statins, like Crestor, Lipitor, rosuvastatin, pravastatin, those kind of things. Some of them, in some people, they can get an elevation in liver enzymes, and your healthcare provider would be the one to determine whether the risk for you is outweighed by the benefit for cardiovascular disease protection. I mean, most of the time it is, but I wanted to point out that even in cirrhosis, these statin medications are generally safe and beneficial. So just don't feel like if you have a liver issue, you can't take a statin medication. So what you can do about statins or about drug-induced liver injury is just make sure that you're paying attention to the amount of acetaminophen in your pain medications, if you have any, in your cold and cough medications, and just general pain medication, because it can really add it quickly. Check any supplements and herbals on the website, and then ideally have your healthcare provider look at what you're taking, and they can determine whether it interacts with any of the actual prescription medications that you might have. Okay, now we're going to go to alcohol-related liver disease. This is just a kind of looks like someone's eyes are bigger than his liver. It's kind of a joke. But alcohol in our culture and in many cultures is everywhere. This is a grocery store that's very close to me, and it has a bar in it, and you can get alcohol and drink while you shop, which is pretty common in many areas. I just thought that. This is a graph to show how common alcoholic liver disease is across the world. They said that beer is actually the preferred alcoholic beverage in America, or I think in all of the Americas. So alcohol is a neurotoxin. It actually causes cancer. Several types of cancer are linked to alcohol intake: liver, breast, head and neck, esophageal, and colon. It's a depressant. It's a contributor to many accidents and injuries, and it's not something that humans have to have in any way for survival. Yet, the vast majority of Americans have or can or do drink alcohol at some point in their life or in the last month. So what exactly is a drink? I think it's very easy to underestimate how much alcohol you're drinking, especially now that they make wine glasses that are enormous, and if you pour what looks like a reasonable amount in it, it could be 2 or 3 times what an actual drink is. So one drink is 14 grams. And I'm going to go back real quick on that. And so 14 grams of alcohol, which is 1 12-ounce beer, 1.5 ounces of a spirit, or 5 ounces. So how much alcohol is actually safe? If you ask the World Health Organization, they would say that no alcohol is absolutely safe. But in general, we recommend that women and adults 65 and older drink 1 or less drinks per day, or 7 or less per week. And men, it's about double that, 2 per day, 14 per week. And they define binge drinking as 4 or more drinks for women or 5 or more for men on a single occasion. So if you're going to go watch the Chiefs game or something, and you drink 6 beers, that would technically be considered binge drinking according to the guidelines. So although no amount is safe, these recommendations are pretty darn safe. You can be confident that you are staying within the guidelines, and you should not develop liver disease from that amount of alcohol consumption. But that is only in patients with healthy livers. If you have some other type of underlying liver disease or cirrhosis, there's no level that would be considered safe. And I just wanted to point out as well that just because those recommendations have been shown to be relatively safe for the liver, it doesn't mean that they don't cause other issues. Alcohol still does increase your chances of those other cancers, even in recommended amounts. So just be careful about that. Another thing that you can do with alcohol to help protect your liver is kind of harm reduction things. So don't drink every day. If drinking every day taxes your liver more strenuously, having breaks or for 2 to 3 days at a time is good for your liver. Don't smoke. Smoking independently increases the risk of developing cirrhosis of your liver. If you do have alcohol, drink it slowly and try to drink it with food so that it slows how quick it's absorbed into your bloodstream and how fast it's going to your liver. Don't binge drink. Drinking many drinks at the same time is much harder on your liver. And then coffee, black coffee has been shown to be protective to the liver, which we know that. So what if you do drink more than that? There's many different screening tests, and you can talk to your healthcare provider and they can go over several with you, but this is one of the short ones that I think is kind of helpful. So if you think about yourself and you say like, okay, how often do I drink containing alcohol? I just put like an example there. So if you put 2 to 3 times a week, I have a glass of wine or a beer or something like that. And then number 2, how many drinks containing alcohol do you have on a typical day? Let's say that you have 3 or 4. That's another point. And then how often do you have 6 or more drinks, which would be considered binge drinking? And if you put less than monthly, that totals 5. And according to this, any number equal or above 4 identifies the vast majority of men and women that do have some sort of alcohol use issue. So if you do drink more than the recommended amount, ideally you would make efforts to bring your alcohol consumption back into the recommended guidelines, and then just make sure that you have to accept that there are other health consequences with drinking alcohol, and that exposure increases those issues. So how do you know if the amount of alcohol you're drinking is causing harm to your liver? You can see your healthcare provider and they can do a set of labs. They can also do an ultrasound or a FibroScan. And the ultrasound, it is pain-free. Many of you have probably had ultrasounds of your heart or your kidneys or just some other issue, or like women who are pregnant will have an ultrasound. So it's a pain-free test. It can tell you if you have fat in your liver and kind of give you some ideas about the appropriate size and things. You can get your liver enzymes tested and your other liver labs. And then a FibroScan is similar to an ultrasound. It actually, and it's also painless. You can have that done in the GI lab, and basically it'll give you a readout that will tell you how much fat you have in your liver, and it will give you an idea of how much scar tissue is in your liver. So those are all things you can do. I wanted to put this up here. So if someone does have alcoholic liver disease that's affecting their liver, many times they will have elevated liver enzymes. And this is an example of elevated liver enzymes in a person that was drinking, then stopped drinking, and then began drinking again. And you can see how the bilirubin increased substantially. And then many times the lab pattern, which, just for your own knowledge base, the AST will be higher in alcoholic liver disease than the ALT. And you can see in this patient, that's exactly what it looked like. So there's pretty clear elevated liver enzyme patterns with several different types of liver diseases, and this is an example. Okay, so what can you do? Avoid alcohol completely, and then you know for sure you are good when it comes to alcohol. Or stay within the guidelines if you do drink. Try to practice those harm reduction strategies to minimize the impact on your liver. Make sure you have your liver enzymes checked occasionally according to your healthcare provider's schedule for you. And then if you do drink more than you would like to, and you feel like it's causing harm to your liver or to your health or just to your life, just know that in the past, Alcoholics Anonymous is a resource that has been helped millions of people. I know we used to recommend it all the time when I used to work in liver disease, but there are also tons of other resources too, if that's not something that you consider doing. And there's lots of social groups that are focused on not drinking alcohol and things like that. So there's tons of support out there if you feel like you want to cut back or cut alcohol out completely. Okay, so now we're going to move to metabolic liver disease. And this is just this is just kind of a joke that I saw that I thought was kind of funny. But so metabolic liver disease, I'm going to just call it metabolic liver disease because it's kind of a mouthful. It's called MASLD or MASLD. It's metabolic associated steatotic liver dysfunction. And essentially what that means is liver problems that are associated with fat deposition in the liver that's also associated with metabolic syndrome. And that's why I'm going to call it metabolic liver disease. It's kind of metabolic liver disease can cause cirrhosis of the liver, just like hepatitis C and hepatitis B can, and just like excessive alcohol can. Many people don't realize that being overweight, having diabetes, having sleep apnea, that sort of combination of health issues makes them at higher risk of having liver problems as well. This is what, on the left, the liver tissue would look like if you would do a liver biopsy in fatty liver, well, it's called fatty liver disease. It used to be called, but now it's called metabolic liver disease. You can see how much all the white is fat that's been deposited in the liver. And on the right, that's what a normal liver tissue. So metabolic syndrome is just a group of things that health issues that go together that are all related to insulin resistance and being overweight and kind of having more calories coming in than what your body can safely use and take care of. So if you have any or all of these issues, your chances of having liver issues related to that are higher. So just keep that. So basically, we think of metabolic related liver disease as the liver's part of metabolic syndrome. That's kind of the best way. It's the most common chronic liver disease in the world, and 30% of the entire world has some fat in their liver. And as you can see, I wanted you to look at this graph just to show that the United States is not the only country that has this issue, it is worldwide. So there's another, basically, you can have liver deposition or fat deposition in your liver, and that will increase your health risks to certain things we'll discuss, but it isn't necessarily actively causing a lot of harm to your liver. But there's in a certain subset, they have this thing called MASH, which is metabolic associated steatohepatitis. And that's basically this inflammation that is associated with the fat in your liver. So I kind of think about it as like an inflamed fatty liver, and that is the type that's most likely to lead to cirrhosis. So like if you had a group of people that had fatty livers, that had fat deposition in their livers, and you took the number one cause of death of those people is not going to be their liver, it's going to be heart disease. And most likely that group of people will not develop liver failure over time or cirrhosis. But a small subset of those people that do have fat deposition in their liver have this sort of active inflammatory process happening, and those people are likely to develop fibrosis and eventually cirrhosis. But fortunately, like I mentioned before, it takes many years usually, so you have plenty of time to intervene and stop that process. So how do you know if you have fat in your liver or if you have this active inflammatory process happening in your liver related to the fat? You basically have the same tests that you would do for alcoholic liver disease, but you also would want to have all the tests for metabolic syndrome and things like that. So you would, if you had high blood pressure, high cholesterol, if your waist circumference is large, the hemoglobin A1C that I put the arrow to, that's a test for diabetes, essentially. So the workup for liver disease is generally pretty standardized. There's a few different things that you test, but for metabolic liver disease, you would definitely want to get the labs that are related to diabetes, along with blood pressure, cholesterol, and that kind of thing. And I did put this on here because occasionally, most of the time, we can diagnose liver disease without doing a liver biopsy. But occasionally, if the diagnosis is unclear, they will do a liver biopsy and look at the tissue under the microscope. And I wanted to show you this as an example of someone who has metabolic associated steatohepatitis, or MASH. And unlike the alcohol, as you can see here, the ALT is higher in this person than the AST, although not much. And notice how the liver enzymes are much lower. And this is one of those things that I think is an important point, because a lot of times people will have we'll call it mildly elevated liver enzymes. You know, some people might actually categorize this as mildly elevated liver enzymes. But even in that case, they can have an active inflammatory process happening that is causing harm to their liver over time. So I wouldn't ignore elevated liver enzymes like this level, even though they're not 400 or 500 or 1,000, like they can get to. So just keep that in mind when you get your labs done. If they are elevated, they should be investigated. This is another example of a patient, and you can see that this person has high hemoglobin A1C, so they have diabetes. And I believe this patient, I made notes for this, was like in their 40s actually, and they actually had metabolic associated steatohepatitis. And we're not talking about children today, but children can develop this issue, and because of the rates of obesity and things increasing, sometimes these people can develop cirrhosis earlier in their life than what we had seen in the past, just because they're developing these metabolic issues so earlier in their lives. Okay, so what can you do about metabolic associated liver disease? Basically, like so many things that help the rest of the body, getting to an appropriate weight is the first step for most metabolic associated liver disease, trying to bring your weight down. The Mediterranean diet has been shown in research to be beneficial for metabolic related liver disease. But any diet that you enjoy that is not filled with processed foods, as long as it's whole fat foods that brings your weight down, is probably going to be a diet that would actually improve this issue. It's also important to be physically active. You don't actually have to lose weight to have some improvement with your liver and your heart and everything. So being active is literally the best medicine there is on earth, is physical activity. And that includes the liver's helped by that as well, just like the rest of your body. And I did want to put this in here. It's a little bit tricky, but there are people who aren't necessarily overweight who develop metabolic associated liver disease. It's the vast majority of people are, but this is especially common in Asian people who can develop metabolic liver disease at much lower weights. So if you do have elevated liver enzymes, make sure that you get them tested, because even if you don't fit that classic pattern of being overweight, you could potentially have metabolic related liver disease. But most people do. Most people are overweight who have this issue. So medications, many, I'm not sure, what your guys' history is out there, but you might have heard that there's new medications that are helping people lose weight. This is just an example of a couple of them. There's pretty amazing things being done through surgery and through medications to help people tremendously get to a more normal weight or bring their weight down. There's also procedures you can have done. There's gastric bypass surgeries. Many of you may have heard of that. A sleeve gastrectomy is sort of like similar to that in a way, but a little bit less invasive in the fact that they just take part of the stomach off. They do not change how your intestines function in any way. There's also procedures now that they're able to do through the endoscope, so they don't even have to cut you open or do even laparoscopically. They're able to do things to kind of make your stomach smaller and help you lose. And I just wanted to let you know that we have a total weight loss center here at North Kansas City Hospital, and it's excellent. And if you do have metabolic related liver disease, they can help you determine what the best pathway is to address and get your weight down and address that issue. So for metabolic related liver disease, work as much as possible to bring your weight to a healthy level, be as physically active as possible, even if it's not making you lose weight, just in walking. It does not have to be strenuous. Many times people, it's kind of a positive loop, and I've seen this with many people. They're able to maybe go to the weight loss center, take a medication to help lose 20 or 30 pounds, then you have less pressure on your joints, and maybe your back or knee pain doesn't hurt as bad. Then you're able to walk more. Then that actually makes you able to lose a little bit more. And so anything you can do to get yourself in that positive, active weight loss mode is going to help your liver if you have the issues with that. And it's going to help your heart and everything to make you feel better as well. And then if you do have if your liver enzymes are elevated, especially if you have metabolic syndrome, diabetes, high blood pressure, high cholesterol, obstructive sleep apnea, those kind of things, and even if your liver enzymes are just mildly elevated, make sure that you actually investigate that and don't ignore it. Because sometimes people can leave it kind of festering there. And getting a diagnosis of metabolic liver disease could potentially help you get approved for some of those other options, like surgery and medications. So it's something that if you have it, you want to know you have it because you can do something about it. Okay, so basically, this is kind of a lot of words at the end, but the summary of what you can do about your liver when it comes to the viral hepatitis A, B, and C. For A and B, make sure you get a vaccination and get tested for B and C at least once, especially for hepatitis B if you're born outside the United States, if you're born to someone who was. For drug-induced liver injury, watch the Tylenol intake, check your supplements, and talk to your healthcare provider to make sure that any supplements or herbals you're taking are not interacting with the medications that they have you on if you take medications. With alcohol, drink moderately within the guidelines. Make sure that you have your liver enzymes tested. If you do drink more than that, and you can get an ultrasound, it can tell you if you're having fat deposition in your liver and that kind of stuff, which also happens with alcohol, by the way. And then look into resources for cutting back or quitting if you feel like you're drinking more than you'd like to, or it's causing harm in your life. And then for metabolic liver disease, be as active as possible and make sure to investigate even mildly elevated liver enzymes. And that's it. You said 45 minutes, and it was exactly 45 minutes.
That was so good. This is a complete example of you do not know what you don't know. Thank you so much, Melissa. We did have a couple questions pop up, so
Sure.
let me make sure. And we do have the chat open, the Q&A open, and then anybody that's attending, I also gave privileges if anybody wants to unmute themselves and ask a question verbally. But let me start with the first question in the chat. It says, is there a national database or some way to find out if we have gotten the immunizations? And is it bad to double up?
So I would talk to your healthcare provider. I don't know if many times you can go to like the Clay County Public Health Department to get immunizations. I'm not sure if they can tell you if you haven't actually gotten one there, but it should not be harmful to get the immunization if you've already had it. So you can talk to your healthcare provider about that, and they can let you know, some people have other reasons why they can't get immunizations and things like that. But generally, it wouldn't harm you to get it if you didn't know you had it. It shouldn't cause you harm to have it again. So.
Wonderful. That was helpful. Is there any lab that somebody could have drawn to see if they maybe had the immunization and then they would have antibodies available, or is that?
Absolutely. Yeah, you can just ask your healthcare provider to test for the antibody for hepatitis A and B. Of course, we don't have a hepatitis C vaccination or immunization. But if you had hepatitis C, you would get the antibody to see if you've been exposed to it. You wouldn't have an immunization, but then you could just see if you actually have been exposed to it and if you have it. So that's the thing. But yeah, you can just get your antibody tested and they can let you know if you have immunity to it.
Awesome. Wonderful. I'll have a moment of pause here to see if anybody else wants to come off mute and ask any questions. That was so good, Melissa.
Well, thank you.
Looks like no more questions, but we will be sending this recording out to everybody who signed up for today's educational offering. And in addition, please check out www.nkch.classes for all of our screenings that we do in the community. One of the things we do is hemoglobin A1Cs, and that's an important number to know, especially related to liver disease. So thanks for joining us today and have a great day.
Thank you for having me.